Oh, put your egg in the freezer? Is it really possible? Yes. In this video, myself, Dr. Sneha, fertility consultant and gynecologist, will discuss the 4 commonly asked questions and what you need to know before egg freezing. Question number 1. Why should we freeze the eggs? It is important to remember that every woman is born with a limited number of eggs. The maximum number of eggs is when you were in your mother's womb, seen at about 4 to 5 months in the mother's womb. This is about 6 to 7 million eggs. At birth, this decreases to 1 to 2 million. And at puberty, it decreases to 3 to 4 lakhs. And during the process of menstruation, every cycle a group of eggs begin to grow. And it decreases to about 400 by the time you reach menopause. Did you know that most of your eggs is over by the time you reach 37 years of age? So the earlier you freeze your eggs, they tend to be of better quality, yielding a better pregnancy rates and lower abortion rate compared to freezing the eggs at a later stage. Question number 2. What test should we do to know how many eggs you have? So 2 main tests are done. One is AMH and the other is AFC. AMH is a blood test which stands for serum anti-Mullerian hormone. Usually, though there is a variation in this hormone level during the course of the periods and in between the periods, it more or less remains the same. So this is usually not done depending on when you get your periods, and any day of the periods the blood can be drawn. And if it is more than 4, it's considered a good AMH. 2 to 4 is also good. Less than 2 is a little less than 1 is further less, and so on. If your AMH is low, you may need multiple cycles of egg freezing. And next is AFC or antral follicle count. So what is this? This is when we do a scan, we see how many small eggs are seen in the ovaries. If it is more than 10 in both the ovaries combined, it's a good ovarian reserve. 5 to 9 is borderline, less than 5 is poor ovarian reserve. So this helps us tell you what are your chances of getting the eggs in the cycle and how many probable cycles of egg refreezing you will need. Question number 3 is what is the process of egg freezing? So it is important to remember that egg freezing, like any other process of IVF, the process of egg freezing starts on day 2 of the cycle. This is because all the eggs are small on this day, and then as and when the periods progress, one of the eggs become bigger, so the number of eggs we finally get decreases. So what we normally do is we start injections after scan on day 2 or day 3 of your cycle, and these injections goes on for about 10 days. And in between you will have 3 to 4 visits to the hospital to see how your eggs are growing. And during this process, we may have to change the dose of injections. Most of these injections are extremely small injections. They are usually painless and can be taken at home by yourself, self-administered. So you can also continue with your work while undergoing this procedure. And in between 3 or 4 days, you'll have to come to the hospital to get yourself monitored. And the process of egg retrieval is done under anesthesia. It's a daycare procedure. You come in the morning, you can go back by around afternoon, and you can get back to work the very next day. So usually during this procedure, 1 day of taking off should be sufficient in most of the cases. The final 4th question is, how many eggs do you need? See, it is important to remember when you're freezing your eggs, at what age. If you freeze your eggs at a younger age, then about 18 to 20 eggs are enough. That is less than 35 years. However, if you're more than 35 years, you may need more than 20 up to 30 eggs also if you're more than 40 years. However, the crux is, as you age, the number of eggs comes down and the quality also comes down. So it may not be possible to retrieve so many eggs. So it's always better to freeze at an earlier stage and provide yourself with a better pregnancy rates than freezing it at a later stage. So do you always use these eggs? It depends. Even after somebody who has frozen these eggs, they get married at 36, 37, we ask them to try naturally for a few months. If it's not happening, then we are always there. These eggs are there. However, it's not 100% pregnancy chances. So it all depends on your quality of eggs, the sperm quality, the resultant embryo quality, and the type of uterus and lining that we obtain during this procedure.